Most men don't even notice it happening, and that's exactly the problem. Your prostate can start growing silently, years before you ever feel pain, before any doctor mentions surgery, before medication ever enters the conversation. No dramatic symptoms, no obvious warning, just small, quiet changes that most men brush off as nothing, until one day, they can't anymore. Here's what's terrifying about that. By the time most men walk into a urologist's office, the damage has been building for years. And the worst part? Their bodies were sending signals the entire time. Signals they ignored because nobody told them what to look for. So, let me ask you something directly. Have you noticed any changes in how you urinate over the last few months? Anything that feels a little different, a little slower, a little more urgent than it used to be? If you're over 60, your answer to that question matters more than you realize. I am Dr. Natalie Parker, and if you want to keep receiving important content about health after 60, subscribe to the channel and turn on the notification bell. Now let's get into this, because what I'm about to share with you are 7 early warning signs that your prostate may already be enlarging, and these are not the obvious ones you've already heard about. These are the ones most men miss entirely. The subtle signals your body is sending right now that could save you years of serious problems if you pay attention to them today. Let's start with the first one, and honestly, it might already be happening to you. You're urinating more frequently, but only passing small amounts each time. Think about that for a second. You go to the bathroom, you go again an hour later, and again after that, but every single time you're only releasing a little bit. Your bladder never feels truly empty. Most men just assume they're drinking more water or getting older. But here's what's actually happening inside your body. As the prostate begins to enlarge, it presses against the urethra, which is the tube that carries urine out of your body. That pressure narrows the channel. Your bladder has to work harder and starts contracting more often, even when it's not full. This is not a bladder problem, this is a mechanical pressure problem, and it usually begins years before pain ever shows up. If this sounds familiar, don't brush it off. Your body is already talking to you. The second sign is something men joke about constantly, and that's exactly why it gets ignored. A weak or slow urine stream. If it takes longer to get started than it used to. If the stream feels weaker, if it stops and starts or dribbles at the end instead of flowing cleanly. This is a classic early mechanical signal of prostate enlargement. And when men laugh about it, they're unknowingly describing a real problem. What's happening is this. The prostate is narrowing the urinary passage. Your bladder muscle compensates by squeezing harder to push urine through. That works for a while. But over time, that bladder muscle gets fatigued. And when it does, symptoms don't just stay the same. They accelerate. A weak stream today can become a serious obstruction tomorrow. Now here's where it starts to affect daily life in ways men really don't talk about. Sign number 3 is straining to start urination. Not just waiting a few extra seconds, actually pushing. Concentrating, tensing up just to get things going. A lot of men stand at the toilet for 30, 40, even 60 seconds before anything happens. They start adjusting their habits without even realizing it, avoiding public restrooms, skipping trips out because they're worried, feeling a low-level anxiety around something as basic as going to the bathroom. This is not normal aging. Needing to strain means your bladder is generating extra pressure to overcome resistance. Your prostate is directly resisting urine flow. The coordination between your bladder and your urethra is breaking down. This is your body asking for attention, not something to push through and ignore. The fourth sign surprises a lot of men because it doesn't feel like a typical prostate symptom. It's sudden urgency, that feeling where you need to go right now and you're genuinely afraid you won't make it. You might feel it when you hear running water, when you're stuck in traffic, when you can't find a bathroom quickly enough. That kind of desperate, immediate urgency. Here's the science behind it. When the prostate obstructs urine flow chronically, the bladder becomes what's called overactive. It's been fighting resistance for so long that it becomes irritable. It starts firing signals before it's anywhere near full. Men often experience this symptom before they even notice the nighttime urination issues. And when it starts happening regularly, it's a sign the obstruction has been building for a while already. Does this sound like your life? Be honest with yourself here, because this next one is where the real damage starts. Sign number 5 is waking up at night to urinate. And I want to be very specific about this. Waking up occasionally, once in a while, can be normal, But waking up every single night, especially 2 or 3 times, that is a red flag that goes way beyond just inconvenience. Nighttime urination, which doctors call nocturia, happens because the bladder never fully empties. Pressure builds faster. The hormonal systems that normally reduce urine production at night get disrupted. But here's what most men don't realize. This isn't just about being tired the next day. Fragmented sleep drives up blood pressure. It increases insulin resistance. It raises cardiovascular risk. Prostate enlargement doesn't just affect your urine. It affects your entire body through the downstream effects of poor sleep. Every night you lose sleep to the bathroom is a night your heart, your metabolism, and your brain are paying a price. Now, at this point in the video, I want to share something with you. Because understanding these signs is one thing, but knowing what to actually do about them is where most men get lost. There are common mistakes that actively make prostate problems worse, and a lot of men are making them right now without knowing it. The medical guide to avoid the mistakes that damage the prostate. After 60 is available in the pinned comment below this video. It's designed specifically to give you clear, medically grounded guidance on what helps and what makes things worse. Check the pinned comment when you're done here. Now let's finish the list because these last 2 signs are the ones most often overlooked entirely. Sign number 6 is feeling like you still need to go right after you just went. You finish urinating, you step away from the toilet, and within a minute or two, there's this lingering pressure, a sense of fullness, like your bladder didn't fully release. This happens because residual urine is staying trapped inside the bladder due to the obstruction from the prostate. Your body literally cannot empty itself completely. And here's why this matters beyond discomfort. Over time, that retained urine stretches the bladder wall. It creates conditions where bacteria can multiply. It weakens the bladder muscle. It can eventually lead to stone formation. This sign is one of the most underestimated on this entire list. Men feel it every day and assume it's just how things are now. It is not. And catching it early makes a real difference in outcomes. Sign number 7 is the one that should stop you in your tracks if it's happening to you. Recurrent urinary tract infections, or burning during urination. Healthy men rarely get UTIs. When they do, it's almost always a signal that something is wrong mechanically. An enlarged prostate creates stagnant urine inside the bladder, and stagnant urine is a breeding ground for bacteria. If you've had burning while urinating, cloudy or unusual smelling urine, recurrent infections over the past year, this may already be the first medical complication of prostate enlargement in your case. At this stage, continuing to ignore symptoms doesn't just risk discomfort. It risks permanent bladder damage, acute urinary retention, and emergency intervention. Here's what I need you to understand about all of this. Most men don't miss these signs because they don't care about their health. They miss them because they've been told their entire lives to expect physical decline and push through it. They've been told that slowing down, struggling, adjusting your habits around a failing body, that's just what getting older looks like. It is not. There are 3 beliefs I hear constantly from men who come to see me far too late. The first is this is just aging. The second is I'll deal with it when it gets worse. The third is I don't want medication or surgery, and I understand all 3 of those. But here's the reality. Early stage prostate enlargement is the easiest stage to address. When ignored long enough, it progresses to acute urinary retention, emergency catheterization, and permanent damage that can't be undone. Timing is everything with this. And let me be clear about a few things that actively make the problem worse because I see men do these things all the time thinking they're helping. Reducing water intake to urinate less. I hear this constantly. Men think if they drink less, they'll have fewer symptoms. What actually happens is urine becomes more concentrated, which irritates the bladder lining, which worsens urgency and frequency. Drinking less water does not solve a prostate problem. It makes it worse. Relying on over-the-counter prostate supplements without medical guidance. Most of those products are underdosed, not evidence-based, and designed to mask symptoms rather than address what's driving them. Some of them provide a false sense of security that delays real care, waiting until pain appears. This is perhaps the most dangerous mistake of all. Pain is a late signal. By the time significant pain arrives, significant obstruction already exists. Prostate problems are best addressed long before pain shows up. If you're waiting for pain as your signal to act, you're already behind. So, what actually works? Hormonal balance matters enormously here. The primary driver of prostate enlargement is testosterone converting to DHT, and managing that process through evidence-based approaches can meaningfully slow the growth. Anti-inflammatory nutrition matters too. Processed foods, excess sugar, and alcohol directly fuel prostate inflammation. Your daily eating habits are either working for your prostate or against it every single day. Bladder training, proper hydration, pelvic floor coordination. These are all tools that a knowledgeable clinician can guide you through based on your specific situation. And a simple medical evaluation, which includes a physical exam, PSA assessment, and ultrasound, can give you a clear picture of where things actually stand. It does not automatically mean medication or surgery. It means information. It means options. It means staying in control of what happens next instead of being forced into crisis management later. Your prostate is not your enemy. It is a hormone-sensitive organ that is responding to the changes happening in your body as you age. And when you pay attention to what it's telling you early, you give yourself the ability to manage those changes on your own terms. So, let me answer the question we started with. Can you actually catch prostate enlargement before it becomes a serious problem? Yes, absolutely yes. But only if you're paying attention to the right signals. Frequent urination in small amounts, weak or slow stream, straining to start, sudden urgency, waking up at night, that feeling of incomplete emptying, and recurrent infections. These 7 signs, showing up before pain, before emergency, before major intervention, are your window. Don't close it. If this video gave you something useful today, subscribe to the channel and turn on the notification bell. Every week, I put out content designed to help men over 60 stay informed, stay healthy, and stay ahead of the problems that most people only hear about too late. And remember to check the pinned comment below for the medical guide to avoid the mistakes that damage the prostate after 60. I'll see you in the next one.